to bulge on the right side. If the fossa in this case is bulging to the right side, that's the only clue. This indicates that something wrong on the left side. Okay, what could be wrong? You can have a hypoplastic LV, it's not hypoplastic. You can have aortic atresia, there was no aortic atresia. You can have coarctation of aorta, there wasn't any coarctation of aorta. So then what was it? Look, the fourth chamber is looking okay, but let me tell you, fourth chamber is not okay. Done? Okay. So I'll just wrap it up because they want more. So probably I'll just give one or two more slides, because mine was just to share with you what is wrong in fetal echo then. So now this, you see a little thinner flow in the left side, and reducing the Nyquist limit, you see some aliasing there. On 2D you didn't get any clue. Okay, and this was the patient of a mitral stenosis because of the Gaucher disease. All right, such a big diagnosis with a trivial or a very small clue. Same happens with coarctation of aorta. You don't get direct signs. What happens in coarctation of aorta? There is a resistance in the aorta, and this causes a the preload afterload problem in LV, and the blood flow from RA to RV is reduced. So LA size becomes smaller, LV size becomes smaller, RA and RV becomes bigger. And the diagnosis of coarctation of aorta is not based on the direct signs, it's based on the disparity of the chambers. I think we do not have great time, so I think I'll cut short here. Thank you for your patience listening.
I think that was a really superb talk, showing a lot of pitfalls in fetal echocardiography. The only comment I would make is that it may be a good idea to do a three-dimensional, I should say four-dimensional, right? Should do a 3- and 4-dimensional echocardiography in the fetus. As a matter of fact, what the reason I think I do it, when I remember the very first time ever anyone did a 3D and 4D echocardiography, it was myself when I was consulted to go to Washington to do an echo on a fetus just to make sure the patient had an AV canal defect. The fetus had an AV canal defect. The question was whether the valves, the attachment of the valves was in the contralateral ventricle. So if it was in the contralateral ventricle, then there would be a recommendation to terminate the pregnancy. If not there. And so when I did the fetal echo, the first thing I did was to immediately grab it in 3D and 4D right away. And if I hadn't done that, after that the fetus moved. And there's no way, you can't tell the fetus to come back. You know, you can tell an adult person to move or turn on the left side. You can't do that to fetus. So that's the only view I've obtained, but it was very clear that there was no contralateral attachment of the leaflets. So therefore, we did not actually advise any abortion. The patient did okay and delivered normally there. But just to give you, so it's many times good to do a fetal echo, grab it in 3-dimensional and 4D, because if the fetus moves, you may not be able to get that view again for a long time. You know, so once you grab it, you have everything with you, and then you can cut and splice, and you can cut and get sections. That's only
I think I do 3D echo in every patient.
Yeah.
So let me tell you a limitation there.
Yeah, okay.
The resolution is further bad. It's worse than 2D. The 4D, 3D echo is excellent once you're talking about 26, 28 weeks gestation.
Yeah.
The size almost doubles. Right? Once you're talking, because in India there's a peculiar problem, and I think the West also, the 24 weeks is the time when you can terminate the pregnancy. In India, it's 20 weeks.
Oh, I see.
If you have an abnormality, even whatever serious it could be, if it is compatible with life, you can't have a termination of pregnancy.
Mm-hmm.
So I am supposed to give the diagnosis before 20 weeks.
Oh, okay.
So we have so many various methods, where we call as a 5D. There is something called 5D. It's an interactive 3D where you just pinpoint where is the aorta, where pinpoint where is SVC. There are 7 points you just mark there,
okay.
and it automatically gives you 19 views.
Right.
You know, the views which are important for a fetal cardiologist. 3D, you put 3D, the image becomes very lousy. You're talking about the size of an almond. 3D doesn't work, sir.
Okay. No, maybe because it's 20 weeks in pregnancy, we do it obviously older, older fetuses, obviously, right. But I think at that age, 20 weeks or so, making a very correct diagnosis is not that easy also.
It's not easy.
Yeah,
Yes.
yeah.
Yes.
You could be mistaking quite a bit, you
Sure.
could miss quite a
Sure,
few
we
things.
do,
Yeah.
we do.
May we now request the esteemed chairpersons to present Dr. U.P. Singh with a memento and certificate.